Taking a closer look at hip fractures and why women have a significantly higher lifetime risk. Those fractures lead to larger concerns with the potential for significant complications. And Dr. Imran Akhtar, an orthopedic surgeon with St. Peter's Orthopedics, is here now with some great insight for us. Doctor, thank you so much for coming in this morning.
Thank you for having me.
Statistics are pretty clear here about women and hip fractures. Tell us a little bit more about that first.
Yeah, so unfortunately 75% of all fractures happen in women. Annually there are about 300,000, more than 300,000 fractures happening, and about 1 in 2, so 50% of women are going to have a fragility fracture in their lifetime.
Wow. What is the reason for it?
So a whole host of reasons, but the primary reason that it affects women more is menopause. So loss of estrogen after menopause leads to rapid loss of bone density and makes you more susceptible to these fractures. The other thing is women's anatomy. So women on average will have smaller bone, thinner cortices of the bone, and all of those lead up to the bone being more frail and more susceptible to fracture.
We were talking off camera too about, we're going to get into a list of things that people can do, women, to try to cut down on their risks. But one thing is really key here. We were talking about the bone density test, but women really need to be proactive on this. So tell me about that. When they go to their doctor, and around what age or what time should they be questioning this when they go to their primary care physician?
Yeah, so the official guideline is at age 65, women should be screened for osteoporosis. But I think after menopause, you should have a discussion with your primary care, perhaps at your annual physical, and ask for a bone density test, especially if you have risk factors, as in early onset menopause. If you're on proton pump inhibitors, so medications for heartburn, they can lead to increased risk. So there are all these variables. If you're a smoker, they all elevate your risk for osteoporosis.
And speaking of that, you mentioned smoking.
Yeah.
So let's talk about some of the ways to reduce risk. One of them is don't smoke, right? Limit alcohol. But what are some of the other things that women can do to try to cut down on their risk of these hip fractures?
Yeah, so you can do weight training. Or just exercise in general, but weight training has been shown to increase your bone density. And the other thing is there are medications out there. So if you are diagnosed with osteoporosis, you can be prescribed medications that can build up or prevent further deterioration of your density. So there are some interventions that your primary care physician can help you. But for yourself, you should have a healthy diet, no excessive alcohol use, don't smoke, and some exercise. Yeah,
and we've got these on the screen as you're mentioning them to us. Let's say, unfortunately, there is a hip fracture. Right. Is it a case of surgery? Usually, sometimes, really depends. How's that handled?
Most often it is surgery, and the reason is it's the fastest way of restoring your mobility.
I see, yeah.
So if you don't participate in surgery, then there's a whole host of complications like bed sores, pneumonias, etc. So the goal after a hip fracture is to get you back to your pre-injury function. And the best way we can do that is to surgically repair the hips and get you moving.
Right.
A lot of times the same day after surgery or the day after.
Get that mobility back, because it affects your overall health if you can't move. Doctor, thank you so much for coming and talking about this important topic. Really appreciate it.
Yeah, pleasure. Thank you for having me.
Of course. And for all of our Women's Health Wednesday stories, you can find them online. Go to Women's Health under the Community tab, and we'll be right back.